Hello there, my name is Marta Shadi. I'm doing a presentation on the discipline in nursing. The reason why I chose the discipline in nursing is because I've always wanted to be a nurse. Currently, I am a nursing assistant at UNC Hospital in Chapel Hill, and in the fall of 2018, I will be starting the LPN program at Durham Tech. Therefore, there I will be exposed to scholarly articles and research in the discipline. And therefore, it would be beneficial for me to understand their process and importance in the medical field. Why nursing? Well, like I said before, I've always wanted to be a nurse. I'm always amazed by what they do for patients, how they affect their well-being. The flexibility of the career, the fact that you're always learning and you're able to move to different departments and floors and meet new people. Also, you're always part of a team, and you always make a difference in a person's life or day by giving them a proper care with medication and or empathy and compassion. What type of writing is required in the discipline of nursing? The writing in discipline needs to follow research practices. Research should be conducted in a systematic manner, allowing the researcher to progress from a general idea or clinical problem to a scientific, rigorous research findings that enable new developments to improve clinical practice. This is mentioned by Leslie Giles in the Nursing Standards Scholarly Journal. Components of a medical research for a scholarly article. You would need a title, author, sources of support, and acknowledgments. You would also need an abstract, which would include background of the test in question, objective of the research, the design, the result, and the conclusion. Thirdly, there would be an introduction where the researcher can include previous findings associated with the research. Fourthly, methods of research being performed and details of the data being collected. And lastly, we have results and discussion. This can be composed of graphs, tables, and statistical data, which is very important. This is referenced by UNC Health Science Library. Why is this type of writing used in the discipline of nursing? The reason why this rigorous process is used to write in this discipline is because it is important for it to be valid. Consequently, the result can be used in the care of patients and by medical entities. Safety practices in the clinical field is a major priority. As a result, proper research practices and transparency needs to be a priority as well. Most important, a claim is made and then research is done to find out the answer to this claim. An example of a finding when I was doing research on the discipline of nursing, I found a study that was performed by 3 Swedish researchers. Their names were Hastrom, Asplund, and Kristen. The main idea was whether nursing care for patients in an intensive care unit can facilitate and effect the effective transition from an ICU to a step-down floor. The point was to uncover how nursing care can stop patients from being readmitted back into the ICU units after leaving the unit to a transitional care unit, like a step-down floor, and successfully be discharged. The research data was collected by interviewing patients in 2 hospitals in Sweden. The research result was stated in the scholarly journal as them writing, to facilitate an ICU patient's transition, individual care planning is needed. It is also essential that the patients are adequately prepared for the change to facilitate the transitional care. Knowledge about transitional needs, empowerment, and patient education seems to be an important issue for facilitating. This is all done by nursing. Interview. My interview was done to Luis Galdames. He is a nurse. He has been a nurse for 11 years in the medical surgical department and adult bone marrow transplant at Duke University Hospital, and a certified psychiatric nurse at UNC Hospital in Chapel Hill. He states, that nursing is a career that is growing in need and demand for the right people. It is a rewarding career that comes with a lot of responsibilities that are governed by hospitals, state, and national levels in order to provide the best patient care in a safe way that is compliant to all nursing practices by a nurse. What did I learn about the discipline in nursing? Is that it's very vast. There's research being done on all aspects of the medical field, whether it's in teaching, leadership nursing, legal nursing practice, and clinical care and research. About the writing in the field, I found that it is important to continue to write in the field in order to make improvements in the field. Ignite discussion on how nursing practices are affected by institutions and how the research can advocate for better patient care. Conclusion. What have I found in the studying discipline in that nursing is extremely controlled because it affects how things are done on all levels of patient care. All claims need to be supported with evidence-based practices and data. New medications and practices are developed. They need to meet medical field standards for best and safe patient care. Ultimately, I'm extremely excited to be a nurse and cannot wait to be there one day. Thank you for watching.